So this is a overall description of the hip joint. The hip joint is a ball and socket joint. The socket is located on the inside of your pelvis, and the ball part is at the head of your femur bone. The hip joint offers a very wide range of motion that allows for flexion, extension, abduction, adduction, internal and external rotation, and circumduction. Without this large range of motion, things like running, jumping, and shuffling would not be possible. The hip joint is made up of three main ligaments, the iliofemoral, the pubofemoral, and the ischiofemoral ligaments. The hip joint also has a layer of articulating cartilage that protects the femur bone from rubbing against the pelvis bone, and it's very important because if the bone rubs on bone, it is very painful. The hip has two main bursas. One is called the tripotrinanic bursa, which covers the bony part of the hip bone, called the greater tripochanter. And it also has the iliopsoas bursa, which is located on the inside of the hip on the groin side. As for muscles in the hip, there's the gluteus muscles located on the back of the hip, the adductor muscles, which are located on the inner thigh. There's also the iliopsoas muscles, which extend from the lower back to the upper femur. The quadriceps, which are a group of four muscles that comprise from the front of one thigh, and also the hamstrings, which are a group of muscles that comprise from the back of the thigh. And those extend from just below the knee. There's one main tendon in the hip joint, and that's the iliotibial band, which is a long tendon that many muscles in your hip and leg attach to. And that's bibliography.
So this is mine, Matt, and Alexa's hip joint. As you can see, we have the femur here and the pelvis here. So it looked like this on a person. Now for the structures and everything that are attached, we have the ligament here, these yellow bands. So starting, like this is the femur, starting from the bottom, this is the iliofemoral. Then you have next the pubofemoral, and the two at the top, because it's a bigger ligament, it is the ischiofemoral. And these are helping, as Matt said, to kind of hold like the femur and like the ball of the ball and socket joint together. And then it's kind of hard to see, but in here, the little white parts is the cartilage. And then we have the two bursas. The top one is the trochanteric bursitis, and then the lower one is the iliopsoas bursa. Next, if we move on to muscles, we have on the back side, this red one that's kind of wrapping around is the gluteus muscles. I know there's more than one, but this is just representing all of them together and kind of showing you where they would be in reference to the whole joint. And then on the front, the pink one that's also wrapping around represents the adductor muscle. Back on the back of the hip again, we have the iliopsoas muscle, which extends from the lower back and pelvis area kind of down across kind of the socket, and attaches to the femur, like the tip of the femur. And then if we're staying On the back, we have our 3 hamstring muscles represented here in the pink. And then if you flip to the front, we have our quadriceps. You can see like the 3 here, and then the black represents the one quad that runs underneath them all. And then we have our tendon, which is represented by the yellow wire, which is the IT band, which kind of runs all the way down the femur. Okay, and then finally, all together, how it works is, as you can see, the whole thing will work together to move around, and which allows for all the movements of the hip. The most common injuries and medical procedures of the hip joint. These injuries happen because of wear and tear, overuse, and just exceeding the range of motion, most commonly in athletes or people within a job that need to use excessive force on their joints who can't necessarily afford to take long periods of recovery. The cartilage is worn down and bone-to-bone friction ensues, increasing synovial fluid within the joint, which causes inflammation, pain, and loss of range of motion. The first injury is osteoarthritis, and it's where joint inflammation, where the cartilage within a joint is slowly wearing away. The cartilage is frayed and provides less protection, which is causing, again, the bone-on-bone friction, and it usually becomes worse with age. The most common cause is a hip injury that wasn't taken care of properly, or in athletes who are repeatedly causing wear and tear of their hip. Most commonly in baseball players, swimmers, and golfers, or improper running form or too much force, not properly prepping joints before exercise and warming them up. Symptoms are pain, particularly at the beginning of an exercise, or pain that extends to the groin and thigh. Some treatments that are like home treatments can start with modifying activity, resting, proper warm-up strategies, losing extra weight. Some patients even say supplementation like glucosamine, but none of these strategies will work for everybody, and it really is on a case-by-case basis. Non-surgical treatments involve these joint injections where a doctor will inject anesthetic into the joint tissue. It usually lasts about 4 months and it relieves the pain. They can also be managed with over-the-counter painkillers for some people. More intense osteoarthritis can be treated with surgery, like an arthroscopy, where surgeon will cut into the hip joint and using a camera will watch to cut certain parts to help with joint stiffness, or a surgery called the osteotomy, where bone is added to the joint, which shifts weight onto healthier cartilage. Some patients even need a full hip replacement. The next injury is a hip impingement, and this one can actually lead to what we talked about before, the hip osteoarthritis. So the hip is a ball and socket joint. The ball glides smoothly in the socket. When the socket undergoes trauma, it leads to this hip impingement. It's inflammation of the joint. At the beginning stages, it's usually not painful, and it usually happens before 40 years old. So when the hip is in flexion repeatedly, it'll damage the socket cartilage. It can also be from a deformity either with the ball or the socket in the joint, and it puts improper pressure on the joint's performance. And the symptoms are pain, usually in the later stages, pain that extends to the groin area, and limited range of motion. So treatments that are non-surgical are similar to osteoarthritis, where physical therapy, resting it, modifying activity, but more severe treatments that will help people who already tried the non-surgical treatments could be a particular osteotomy, where the socket is cut from the connection to the pelvis and it's repositioned, so there's a better fit on the ball and socket, creating less pain and a better range of motion. And those are the references.